Did you know there's a preventable condition that silently claims millions of lives every year? This is the reality of stroke today. On World Stroke Day 2024, the World Stroke Organization, WSO, unveils a powerful global coalition to combat this silent killer. Stroke is now the second leading cause of death and the third leading cause of disability worldwide, with its impact expected to rise dramatically by 2050. The WSO's announcement in Geneva highlights a stark reality. The global burden of stroke has doubled over the past 3 decades. And by 2050, strokes are projected to cause around 9.7 million deaths each year and cost the global economy over $1.6 trillion each year. On World Stroke Day, similar calls were heard in the UK Parliament also.
Sarah Dyke. Thank you, Madam Deputy Speaker. I'm grateful to have this opportunity to address the House on World Stroke Day. Stroke is the UK's 4th biggest killer and the single largest cause of complex disability in the UK. On our current trajectory, the number of stroke survivors will increase by 60% over the next decade, which will swallow up nearly half the current NHS budget. By that time, 1 in 3 people in Glastonbury and Somerton will be 65 or older, so we will be disproportionately feel the impact of the increase in strokes over the next decade.
My husband suffered a stroke, and this is a timely debate, so I want to thank you for securing this. I'm pleased to say he's doing much better now, and he is here in the chamber, as are the Stroke Association, who have been absolutely invaluable to our family and many stroke survivors across the country. I would like to pick up a point that the Honourable Member made about strokes. 1 in 4 strokes happen to people of working age, and 1 in 3 in this group will have to give up their jobs. It is very, very clear that though the NHS has given excellent care to families like mine and to my husband, there is clearly much more to be done.
Thank you. I thank the Honourable Lady, and it's so good to hear that her husband is making such a full and quick recovery. But, Madam Deputy Speaker, World Stroke Day is a pertinent reminder that stroke must be well represented in the new 10-year health plan, and that the government must engage with patients, with carers and health and social care professionals so their lived experiences can help inform policy decisions. Thank you.
It's a reminder of how crucial it is to ensure stroke care is a priority in the upcoming 10-year health plan. Remember that 80% of strokes are preventable simply just by managing your cholesterol, blood pressure, obesity, and making healthy lifestyle choices, and that expanding access to acute treatments can transform patient outcomes. In September 2025, global leaders will gather in New York for the 4th UN high-level meeting on non-communicable diseases, a critical opportunity to drive policy action on stroke. Prof. Sheila Martins, co-chair of the coalition, points out the huge gaps in stroke care and the potential for progress at every stage of the patient care pathway. The Stroke Advocacy Coalition, including health organizations and industry leaders, is united in its mission to engage decision-makers ahead of the 2025 UN meeting. Join the movement to make a difference. Have you or someone you know been affected by a stroke? Share your stories in the comments below. What are your thoughts on the advancements in stroke care? And don't forget to check out our other videos on global health and science. Thanks for watching, and I'll see you in the next video.